Welcome to Bell2Bell podcast, powered by IBN. This original audio production delivers market and sector insights, as well as exclusive interviews with innovative executives shaping the future in fast-moving industries, and may feature a client partner of IBN or one of the 60-plus investor-focused brands within IBN's dynamic brand portfolio. As a multifaceted financial news and publishing company, IBN leverages its extensive distribution network, utilizing multiple proprietary corporate communication tools to introduce both public and private companies to a vast and diverse audience of investors, consumers, influencers, journalists, and other targeted segments of the public. IBN may have received compensation to produce this audio content. Please be sure to read IBN's entire disclaimers for full disclosures. Now sit back, relax, and enjoy the next revelatory episode of IBN's Bell2Bell podcast.
Welcome back, everyone, and thank you so much for making us part of your day as well as part of your due diligence as you're looking for smart and fresh plays out there in the market today. And we've got a company straight from Investor Brand Network. You can learn more about them by going to the Investor Brand Network. Click on the Clients tab there in alphabetical order. You're going to find HealthLynked Corp. The company's traded on the OTCQB under the ticker symbol HLYK. And we're lucky enough to be joined today by Michael Dent. He's the founder, the CEO, and the chairman. Michael, welcome to the show, and thank you so much for making time for us.
Yeah, thanks for having me. Appreciate it.
Well, it's wonderful to have you here. So let's start off for the listeners and viewers that may not be familiar with your company. If you would, describe the business model for us now.
Sure. So HealthLynk's a pioneering healthcare technology company focused on improving the efficiency and quality of healthcare through our advanced integrated platform. So our business model revolves around creating a global healthcare network that leverages artificial intelligence and an extensive healthcare data set to provide personalized healthcare recommendations and streamline patient-provider interaction. So within that, we offer an array of services, including online medical record storage, appointment scheduling, telemedicine, patient engagement tools. And our platform is designed to facilitate the exchange of medical information among healthcare practices, hospitals, emergency rooms, making it more accessible and more efficient to both patients and providers.
Well, as our guest today, if you would, tell us a little bit about your background and what brought you to where you are here today.
Yeah. So I'm a physician, MD by training. I'm the founder of HealthLynked and the CEO here. I graduated from Davidson College in North Carolina with a degree in biology, chemistry, and physics, and did some postgraduate work in immunology and biochemistry. I attended medical school at the University of South Carolina in Charleston, and then went on to do my residency in obstetrics and gynecology at the University of Texas in Galveston. So then I came to Naples, Florida, where I started my practice here, and I focused mostly on high-risk obstetrics and minimally invasive surgery, mostly around robotic surgery and pelvic reconstruction. Then early 2001, I started a company called NeoGenomics Laboratories here in Fort Myers that was based in cancer diagnostics around genomics, and was the founder and CEO many years there. And that became a global cancer diagnostic laboratory. And then now on to HealthLynked, which is in the healthcare AI space, looking at how we can really improve healthcare for everybody globally around the world.
Well, speaking of HealthLynked, let's look back on the year 2023. What do you see as some of the major achievements, milestones for the company then?
Yeah. Well, building out a platform that's designed for the masses, and a global platform is no small task. So in 2023, we made significant strides in expanding the platform and its services, and we focused on building a new enhanced version of the HealthLynked application and revamped our web presence as well. So by updating our online messaging, better communication, and our value proposition, our efforts resulted in really substantial growth in our membership base. And with the increasing number of patients and providers joining the network, we've now turned our attention into more of those conversions. So additionally, in 2023, we expanded our concierge team. So we have internal teams here that handle patient appointments and provide personalized concierge services to our members. And we brought on some key employees as well. So one of those was our new CTO, Chief Technology Officer. And we expanded our technical team to support the advances in our software. Lastly, as we've kind of refined our sales process, we've ensured more streamlined, efficient approach to our members, and we've launched just this past month our paid service to subscribers. So we're really excited about where 2024 is going to go for the company.
Well, let's now talk about some of that recent news, Michael. Achievements for the company you just gave us for 2023. Here, there's been a lot of great news on the press wire. Viewers, use that ticker symbol again, HLYK. Pull up the newswire at Investor Brand Network and read along. But Michael, what do you see as some of the major news that's been out about the company so far?
Well, we've been doing a lot of work, really, I would say, under the radar with HealthLynked and building out a really significant platform to transform healthcare for everybody. Part of that was getting our message out there. So we were featuring a documentary that is now playing on Amazon Prime called Forever, the End of Aging. So we're really excited about that. That was a documentary done by Paul Castro, who is a Hollywood producer, that featured about innovation in healthcare and where the future of healthcare was going as far as anti-aging, functional medicine, and also AI. So we're featured in that film. So definitely go there and take a look at that on Amazon. A really good documentary. We're proud to be a part of that. The second thing for us is we worked on our concierge service here within the company. So we've been building that out to make some changes. And then lastly, the news for today was I've made some significant investments in the company already and have put another $1 million in to help meet our goals for this year. So I'm really excited about that and supporting my vision for where we can take healthcare for everybody.
Well, that's huge news. And obviously aligning yourself with your shareholders by putting in personal investment, that's a lot for people to really understand. And it's a great thing for a CEO as well as the founder and chairman to bring in. We're speaking with Dr. Michael Dent. Well, Michael, let's talk a little bit about the problems that you solve for the health industry. Let's hear it from you as you see it.
Yeah. Well, I think we all know that the healthcare system in the U.S. has a lot of problems. Everybody's dealt with it at some point in time. So I'll touch on the main ones here. The first one I would say is there's a big problem with healthcare information in the healthcare system. So we've all probably been to the doctor where he's asking about records from another physician that he doesn't have, or he's asking us about information that we don't have access to anymore. And that's a problem. And when you look at healthcare, for a physician to make an accurate diagnosis, they need all the information they can on a patient, and it's all important. So that's something that was a big part of our mission, is to really provide more efficient exchange of health information, putting the patient at the center of that. So the patient knows their health history, they know their symptoms. So we're allowing the patient to take a central role there. In the past and currently, it's been the physicians and hospitals have taken that role, and the patient's really on the outside of that. So that's be the number one thing I would say. The second for people is cost. Healthcare is just expensive. We're paying a lot of money for healthcare. Accessibility to it and getting it what we pay for. I think we've seen that to be a big problem in pharmaceutical business where prices of drugs are going up. And so we're looking to, within the platform, offer reward programs back to patients that incentivize them. We offer about 15,000 name brand medical supplies they can buy through us at discounts. And we expect to offer more within the platform going forward. The regulatory and privacy concerns are an issue. We've probably heard of HIPAA, which stands for the Health Privacy Act, where information for patients can't be shared without their permission, which is great in a lot of aspects, but not so good for medical research. So we're allowing members in HealthLynked to participate in improving health research and accelerating medical discoveries. So now individuals can look to participate in things that are personal to them, like breast cancer, Alzheimer's disease, where they can help speed discovery for those diseases. Access to care. So just getting an appointment now can take weeks or months sometimes. So our telemedicine application allows that to be improved. Family management of your medical care. So older family members need oversight, or our younger children need to be managed at the doctor's office. So we provide that connectivity that, because it's patient-centric, allows that to be occur. And then the last two is access to medical information while you're traveling. So if we're away or we're out of the country, we want access to our records, and that's not always available. And the last one would be emergency situations where somebody has a heart attack or a stroke and can't communicate. We're looking at working with EMS to where we can provide access to medical records in those emergency situations, and those can be life-saving.
So with all those solutions that you provide to the existing problems, and I'm sure there's more problems, and I'm sure you have more solutions, who would you say are some of your primary customers then for HealthLynked?
Yeah, well, there are two. The patient, of course, is our primary focus because, healthcare occurs between the physician and the patient, and there really is nobody in between that relationship, people on the outside of that relationship. So we're the first company that's actually facilitating in between that as a concierge or kind of personal guidance to the physician as well as to the patient about managing that care. So that's really important. And the patients that we look to do services are getting their medical records, booking appointments for them, personal healthcare recommendations to them that are specific to their healthcare history, and then providers gain access to our suite of tools, which provides for more efficient practice operations. Patients can book more efficiently. They can get better guidance. So, for example, if a medication is recalled, we can let patients know that right away, and the doctors have to go out and tell them that because we see the medications and know the recall, so we can alert them to that very quickly.
Well, then let's talk about the services you then provide to the healthcare providers, the flip side of that last question.
Yeah. So when you look at the provider, so they have the same issues, but a little bit different view of it. So a patient will come in without medical records, they can't make medical decisions. So we're providing an efficient way for the patient to port their records to that doctor. And that's really important because the patient has access to records. They can share the access with the doctor. Second is practice optimization. So those tools, we have an online scheduling application. We have a check-in application on the mobile phone. You can even check in like you would at a restaurant where you can check in ahead of time, never go to the front desk. And there are benefits to that as far as not being exposed to the same pin everybody's touching, or be at the front desk, everybody's coughing or breathing or might be sick. So keeping patient distance is important. We saw that with COVID. Telemedicine services for the provider. So we're allowing their patients, they need to have access to care, providing that for our services. The concierge service, which is supporting the patient. So if they have questions or need guidance, we provide a nurse that can provide some recommendations to them to go where they need to go, what to do after hours. And then we have marketing tools for the practice to really promote the services they're offering to the patient community. And then just efficiency within the scheduling application itself for them.
Well, let's put those last two questions together and get real life examples. What examples can you provide for us of these pain points within medicine and how HealthLynked addresses them?
Yeah, so I touched on a few of those. So we're all concerned that, someone's going to have to, say, a car accident or a heart attack or stroke, and then we're not going to be able to communicate to a healthcare provider, and the EMS would come in and not know anything about this at all. So by having your records filled out and consenting to allowing access to that information, we can facilitate a very efficient exchange of information that could be life-saving to an individual. Okay, so that's one of the things as far as real-world examples. The second is somebody described this situation to me recently. They needed a medication refill. The doctor that they were seeing was retired, so they called in to get the refill, and they said, well, we got to see you before we can refill the medication. It was a blood pressure medicine. And then they said, well, it's going to take a month, we can get you in. So the patient was like, well, I can't get medicine for a month. And they told them to go to a walk-in care. So for those situations, we can facilitate that with our telemedicine services to help with those things. And then we can help the patients find the right doctor. So getting in and getting scheduled more efficiently, that takes a lot of time sometimes, and our team helps with that.
So let's jump into 2024. What do you see as some of the operational goals for HealthLynked here in this year, 2024? And feel free to go beyond.
Yeah. Well, I think our investors have seen, that we've been building the platform for a long time, and we've done it on a very cost-efficient way. So with big goals, that's taken us a number of years to get the platform because we wanted to build a lot of tools that really incorporated integration of the healthcare system. And, the analogy would be maybe building a car and you need that fourth wheel, right, to really make it run. So at this point in time, we have all the tools that we really think will provide an efficient solution to the healthcare platform. And now it's really about doing two things. One, monetizing the application with our consumer base from sales. And number two, bringing in more artificial intelligence and AI integration to provide better resources to provide better care for patients. So we're doing both of those. Now, part of that sales goes to the patient. The other part goes to the medical providers that are out there. And we're starting to look in 2024 at bigger partnerships with organizations, hospitals, ACOs, universities that would accelerate our growth quite a bit. So we're excited about that. And there's a lot happening this year. And we think for 2025, for sure, we're already halfway through 24, the company should start to see a lot of growth. And we're excited about where that's going to take us.
Well, it was exciting to speak with you again here today. We are speaking with Dr. Michael Dent, CEO, founder, and chairman of HealthLynked Corp. And I want you to find that company. So how do you do that? Go to healthlynked.com. That's HealthLynked, healthlynked.com. And of course, just visit us here at the Investor Brand Network. Click on that Clients tab. You'll find HealthLynked in alphabetical order. Michael, absolute pleasure speaking with you today. We expect great things from you and your entire team here in 2024 and well beyond. Thanks for your time today, Michael.
Thank you for having me.
The Bell2Bell podcast is an original content production powered by IBN, a multifaceted financial news and publishing company that delivers next-generation corporate communication solutions. Utilizing proprietary corporate communication tools such as news aggregation and syndication, social communication, and brand awareness techniques, among others, IBN introduces both public and private companies to diverse audiences to enhance reach and recognition. IBN may receive compensation for services and solutions provided to its client partners. You should assume that the owners, officers, and directors of IBN or financial analysts mentioned in this production may hold a position in and may intend to trade the securities in their own accounts. This production is not an offer or recommendation to buy or sell any securities that may be mentioned in this production. The information in this broadcast is presented solely for informative purposes and is not intended to be or should it be construed as investment advice. As in all investments, investment in the featured companies carries inherent investment risk. Listeners should review the companies thoroughly with a registered investment advisor or registered stockbroker. This production by IBN is not purported to be a complete study of the featured company or other companies mentioned. Information used in statements of fact have been obtained from featured companies and other sources but not verified nor guaranteed by IBN as to completeness and accuracy. Such information is subject to change without notice. Please see IBN's full disclaimers and disclosures at www.ibn.fm/disclaimer. Music in this episode is by Infraction. For more, visit inaudio.org.